Take a seat in a sturdy chair, sit up as straight as you can, and try to press the back of your head completely flat against the wall behind you. Do not force it. Just see where your head naturally falls. If you cannot comfortably reach the wall without straining your neck, pushing your chest out awkwardly, or tilting your chin straight up to the ceiling, then pay very close attention. You are in the early stages of developing old person posture. You might have caught a glimpse of yourself in a store window or seen a recent photograph and been shocked by how far your head and shoulders are slumped forward. That hunched, rounded shoulder look doesn't just make you look 10 or 15 years older than you actually are. It is actively causing physical damage. It is the exact reason why you wake up with a stiff neck, why you get tension headaches, and why you have that constant, burning, cement-like ache right between your shoulder blades that no amount of massaging or rubbing seems to fix. But here is the incredibly good news. You absolutely do not need to accept this hunched back as a normal or inevitable part of getting older. Many people assume their spine is permanently frozen in this shape, but in the vast majority of cases, the bones of your spine are perfectly fine. The issue is entirely muscular, which means it can be reversed. By the end of this video, I am going to show you one simple, incredibly effective seated movement that will instantly pull your shoulders back into their proper, youthful alignment. This single 1-minute stretch is going to do two amazing things for you. First, it will decompress your spine, helping you stand significantly taller and walk into any room looking visibly more confident and energized. Second, and most importantly, it will finally shut off that nagging, miserable upper back pain by completely removing the tension that causes it in the first place. To fix the problem, you have to understand why it's happening. You see, chiropractors and physical therapists often focus exclusively on the back. They tell you to strengthen your back muscles or squeeze your shoulder blades together. But the real culprit, the true anchor pulling you down, is actually located on the front of your body. Think about it. After decades of sitting at desks, driving cars, looking down at smartphones, reading books, and eating meals, your chest muscles, specifically your large pectorals, have spent years in a contracted, shortened position. Over time, these chest muscles physically adapt to this position. They become like thick, stiff, tight rubber bands that are constantly pulling your shoulders forward and down toward your stomach. When your shoulders are pulled forward by these tight chest muscles, the muscles in your upper back are forced to stretch and strain all day long just to keep your head from falling into your lap. Imagine holding a heavy bowling ball out in front of you. Your back muscles are screaming because they are constantly fighting a losing battle against your tight chest. You do not need a stronger back. You need to release the tight chest muscles that are pulling your spine out of alignment. Before we do the stretch, we need to set up the foundation. Doing this movement incorrectly can actually strain your lower back, so form is absolutely everything. You do not need to get down on the floor or use any complicated equipment for this. First, find a sturdy, armless dining room chair or a simple wooden stool. Sit right on the front edge of the seat, so your back is completely free and not touching the backrest. Plant your feet flat on the floor, about shoulder width apart, to give yourself a solid, stable base. Now, roll your shoulders up toward your ears, and then drop them straight down. Feel the tension leave your neck. The secret to this stretch is your breathing. When we get into the movement, you must breathe deeply into your belly, not shallowly into your chest. Deep belly breathing sends a neurological signal to your tight pectoral muscles, giving them the literal command to release and let go. If you hold your breath, the muscles will stay locked and the stretch won't work. Now, let's perform the movement. This is called the seated heart opener, and it is the absolute best way to break those tight rubber bands in your chest. While sitting at the edge of your chair, reach both of your hands straight behind your back. Clasp your hands together, interlacing your fingers. If your shoulders are very tight and you cannot clasp your hands, simply grab a small towel or an old necktie behind your back with both hands. Once you have a grip, gently pull your hands or the towel downward, pointing your knuckles toward the floor. At the exact same time, lift your sternum, the center of your chest, straight up toward the ceiling. Keep your chin tucked slightly. Do not throw your head back. You should immediately feel a deep, glorious opening stretch across the front of your chest, your collarbones, and the front of your shoulders. Hold this position right here. Do not bounce. Now, take a slow, deep breath in through your nose for 4 seconds and exhale slowly through your mouth for 6 seconds. Hold this stretch for a full 30 to 60 seconds. As you exhale, imagine those tight chest muscles melting like warm butter, allowing your shoulders to naturally glide backward into their perfect, youthful position. When you gently release your hands and come out of the stretch, pay attention to how your upper body feels. You will literally feel your spine decompress. Your shoulders will naturally rest further back without you having to force them, and that heavy, burning tension in your upper back will be significantly reduced, if not entirely gone. To permanently reverse your hunched posture, you must make the seated heart opener a daily habit. I recommend doing this stretch every single morning, right after you get out of bed, or immediately after you finish your morning coffee. Consistency is key. It took decades for your chest muscles to tighten up. It will take a little bit of daily dedication to keep them open. Try it tomorrow morning and experience the incredible difference for yourself. Disclaimer: the information provided in this video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.